Today we are going to discuss about Down syndrome. Down syndrome usually asked as 3-mark questions in your exam, but if you're a physiotherapist and interested to treat pediatric cases, definitely you will come across Down syndrome. So Down syndrome is a genetic disorder and it is by definition trisomy of 21st chromosome. We all know we have got 46 chromosomes. That means we will have 23 pairs of chromosome. So in the 21st chromosome, there will be an extra chromosome. That means instead of 2, you will have 3. So totally the patient will have 47 chromosome. It occurs mainly due to non-distinction during meiosis. We all know meiosis is the cell division. You can see in the figure, in meiosis 2, chromosome is not splitting apart, right? So one unit will have 3 number and other unit will have less number, right? So there will be non-distinction of chromosome. That means there will not be splitting of chromosomes happen during meiosis. It is the reason for Down syndrome. And because of this extra chromosome, there will be effect in almost all organs. There will be septal defect in heart, and there will be mental retardation, and there will be sterility in males, and there will be duodenal atresia. Duodenal atresia means, you can see in the figure, there will be closing of duodenum, and that will lead to intestinal obstruction. It is known as duodenal atresia. And there will be hypotonia. Hypotonia is otherwise known as floppy baby syndrome. For example, നമ്മൾ ഈ ഫിഗറിൽ നോക്കുമ്പോൾ കാണാം, നമ്മൾ കുഞ്ഞിനെ തൂക്കിയെടുക്കുന്ന സമയത്ത് usually the head should come up, right? But in floppy babies, head won't come up. In the second figure, baby നമ്മൾ prone lyingൽ നമ്മൾ ലിഫ്റ്റ് ചെയ്യുന്ന സമയത്തും baby വളരെ ഫ്ലോപ്പി ആയിട്ട് വളരെ ലൂസായിട്ട് കിടക്കുന്നതായി കാണാം. So it is known as floppy baby syndrome. And next, there are some physical characteristics. That means there are some features you can identify in Down's patient. And first one is simian crease. Simian crease means in your hand usually more than one line, right? At least there will be 3 lines. But in Down syndrome there will be a single line. There will be single palmar crease and it is known as simian crease. And you can see a gap between first and second toe and it is known as sandal gap deformity. And you can also see flat facial profile. That means the nose is flat and there will be low level ear and it is known as flat facial profile. And there will be epicanthal fold. Epicanthal fold means there will be a skin fold in the upper eyelid in the inner corner of the eye. You can also see white spot in iris. In this figure you can identify a white spot in the iris and it is known as brush field spot. So these are some physical characteristics of Down syndrome. Next we are moving to risk factors. Usually the risk factor is maternal age. If the maternal age is less than 20 and it is greater than 35, there will be increased risk for Down syndrome. And there are some screening tests for Down syndrome. Usually the alpha fetal protein will be decreased and HCG will be increased. And in ultrasound imaging, there is a imaging called nuchal translucency scan. There will be thickness of the skin. We are identifying the thickness of the skin in the baby's neck. If the thickness is more, there is increased chance of Down syndrome. So these are some screening tests for Down syndrome. Thank you.